This illustration demonstrates what happens to you when you stand up if you have a tendency to faint. Now if you look here, there is a heart and a brain represented in terms of its filling by the quantity of redness or blood circulating within the body. You can see blood in the gut and blood within the lower limbs, and at this initial upright or lying down posture we might have a blood pressure that is normal. But what happens when we stand up? So when we initially stand, the blood fills with gravity and pools into these lower limb reservoirs, which are huge collectors of blood. And as the blood empties into this reservoir, so it empties the heart and the brain, and the blood pressure starts to fall. Now, if this is unchecked, or if we are susceptible to fainting, for example, if we're dehydrated, then with increasing pooling in the lower limbs and increasing emptying of the heart, we may start to feel slightly unwell. And the reason we feel unwell is because as the heart empties, there are very sensitive receptors within the heart and the neck that start to activate the fight or flight response. And the net outcome of this is that you engage the sympathetic nervous system, which excretes adrenaline, which is a panic hormone that starts to make you feel unwell, feel sweaty, feel lightheaded. And as we continue standing, what happens can be a further expansion and pooling of blood within the lower limbs. It can also pool within the gut, and the heart empties further and the brain also empties further as the blood pressure falls. And here, with the reaction of the fright and flight response, you may then feel the effects of adrenaline, which is the feeling of a pounding heart, feeling hot, nauseous, dizzy, and the need to sit down or get a breath of fresh air. And as we continue to stand and the vessels expand further and take away more blood from the heart and the brain, we start to get levels of blood pressure that are critically low, as you can see here, and we get very dizzy and you're about to faint. So this explains some of the mechanisms that underscore fainting, and you can see how pooling with gravity into the lower limbs and occasionally within the gut as well are the major mechanisms that cause emptying of the heart and subsequent low blood pressure into the brain to make you feel close to fainting.